Thanks so much, Mildred, for getting us started. I'm Dave Kindig. I'm from the University of Wisconsin and co-chair of the Population Health Roundtable, and I join Mildred in welcoming you to this exciting day. Our roundtable, the IOM Roundtable on Population Health Improvement, aims to provide a trusted venue for leaders from public and private sectors to meet and discuss leverage points and opportunities for achieving better population health. The Roundtable's vision, which we worked on in our planning sessions, is of a strong, healthful, and productive society which cultivates human capital and equal opportunity. Given this vision, we believed it was essential and appropriate to partner with our sister roundtable, Mildred's roundtable, in today's workshop, and I appreciate the help that Mildred and her colleagues provided in the planning process. This vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, yes, all of them, and will require robust national and community-based policies and dependable resources to achieve it. Our mission calls for catalyzing urgently needed and sustainable collaborative action to meet this vision. I have one slide only, and this slide shows what we think to be, am I supposed to bring it up here? I will, if I know where it is. Oops, no, that's not it, you know. Great, thank you. This slide lists what we think to be the drivers of this vision and mission. You can glance at it, I'm not going to read the whole thing, but it includes goals and metrics, adequate resources, science-based interventions, public and private policies, multi-sectoral partnerships, and effective communication. We are developing a set of activities in each of these areas, including workshops like today's. We hold these workshops for members, stakeholders, and the public to discuss issues of importance to improving our nation's health. As you know, today's workshop will focus future presentations and panel discussions on accelerating a movement for health and health equity. The notion of helping to catalyze a movement has been part of the Population Health Roundtable's conversation from the beginning. And today we seek to learn from scholarship on social movements and from movement practitioners about the essential ingredients our roundtable should seek to amplify and support in order to further a movement for health and health equity. Our discussion is being aided by two discussion papers in the back of your agenda book from two of our colleagues, Merlin Chakwanyan and Nancy Adler and Christine Bachrach and her colleagues, and we appreciate their help. Merlin also provided a glossary and a summary of the information gathering activity that the Roundtable members participated in the last few weeks, and you can find that there. And I want to personally thank them for their help. I would also like to thank the Planning Committee for the workshop, which included Mildred, Mary Pittman, Terry Allen, Martha Gold, Sonia Magnan, and George Isham, and also thank the staff, our IOM staff of both roundtables who were involved in planning this workshop. Alina Bachu, Karen Anderson, Drew Lamarise, and Colin Fink. Others of our roundtable staff are on hand wearing green name tags. Please reach out to them if you have any questions. We are pleased that many of you are joining us remotely on the web. Please note at the bottom of the agenda, you will find our Roundtable's web address. There you can find information about our meetings and other products and sign up for the Roundtable listserv. At the end of the day, as is our way in our Roundtable, our co-chair, George Isham, will be chairing the end of the day discussion about what do we take with this information and how do we take it from here and where do we go with it. And he will be calling on each of the Roundtable members to make several observations about the takeaways that you have had from this day so that those thoughts can be incorporated in the printed workshop summary that will come out from our work in a few months' time. So that's my welcome and introduction. I'm also excited about this interesting day we have before us, and I'm going to turn it back over to Mildred to introduce our two keynotes for today.